Blessings in the name of the Lord Jesus. Welcome to Paraclet TV, making disciples through the power of the Holy Spirit. For this lesson, our lesson intended learning objectives are at the end of the lesson or the session, 100% of the learners with 100% level of proficiency will be able to, one, to describe the various exceptionalities and apply the best methodologies in handling exceptional learners. So at this point in time, based from our intended learning objectives, our subject matter or the topic to be discussed is about exceptionalities. And when we speak about exceptionalities, not all learners have common characteristics, and based from psychology, they have, of course, individual differences. And one of its differences, of course, is their exceptionalities. And when we speak about exceptionalities, there are two main divisions. Number one is disability, and the other one is, of course, handicap. When we speak about disability, disability is a measurable impairment or limitation that interferes with person's ability. So when we speak about measurable, meaning it can be seen, it can be touched, or it can be heard, something like that. There are, of course, limitations in the ability of the students. The second one is because of disability, handicap is produced. So what is a handicap? Handicap is disadvantage that occurs as a result of a disability or impairment. So when a student or a child has a disability, therefore he is handicapped. And based from this discussion, we will be discussing about different disabilities and, of course, the different handicaps that are results of these disabilities. Okay, there are categories of exceptionality. We have the first category, which is called learning disability. So there are students and pupils that have this disability. So we as a teacher, we have to really take into consideration all of these things. And the first one, the first learning disability is the so-called attention deficit hyperactivity disorder, or in short, and its acronym ADHD. And when our students or our pupils have ADHD, the following are the manifestations. One, there is difficulty in focusing and maintaining attention. So you are going to really give more time in motivating and more time on getting the attention of the student having the ADHD, because they have difficulty in their attention and they have to really have also that difficulty in sustaining the attention of them. And of course, we can also see them having recurrent hyperactive and impulsive behavior. There will be times that they will be shouting. There will also be times that they are angry. They cannot control their emotions. And there will be time that they will be running around the room. And there are other different manifestations of this ADHD. Another learning disability is about speech and communication disorders, or the SCD. So this is characterized that includes voice disorders. And when we speak about voice disorders, the student or the pupils have inability to produce the sounds correctly. So they have the problems of their vocal cords. Some have problems on their tongue. So there is a need of training more of their speaking ability in order for them to produce the sounds correctly. Usually they will stutter, or of course there will be difficulty in spoken language comprehension. And because these students or pupils having speech and communication disorders are very are encountering difficulty in pronouncing the words properly or correctly, of course, it will be a big problem for them to comprehend what they are reading or what they are speaking. Next, disability. We have number 2, we have the social, emotional, and behavioral difficulties, or the SEBD. Under the social, emotional, and behavioral difficulties, we have the first uh, type, which is called autism. And what is autism? Autism can be manifested in different levels of impaired social interaction and communication, repetitive behaviors, and limited interest. So these students and pupils who are having this autism, there is, of course, a problem in social interaction. And of course, in communication, they could not express themselves properly because of the difficulty in speech, as well as they will do behaviors repeatedly, and they will, of course, exhibit limited interest in what we ask them to do. So we must be very careful. So this kind of disorder, autism, really needs pupils of having autism really need a special school for them, so that the teachers who are highly trained. And then we have also the following signs of autism. We have one sign is these students or pupils having these social, emotional, behavioral difficulties such as autism. They avoid or do not keep eye contact. They have really difficulty in focusing their eyes and having eye contact with their mentor or to the teachers. They do not respond to name until 9 months of age. They will never respond when you are calling them, even you are shouting at their names. They will never respond to you until the time that they are already 1 year old. They will pay attention if you are really patient in calling their name. They do not show facial expressions like happy, sad, angry, and surprised. So most of them do not reflect facial expressions to really exhibit what they feel, because it is really a problem for them to coordinate their feelings as well as their facial expressions. They do not play simple interactive games like a pat a cake, and they will only do that when they are already 1 year old. No, they really find it hard to play, especially those that that need dexterity. And of course, another sign, most of them use few or no gestures until 1 year of age. So these are now the signs of autism as one example under social, emotional, and behavioral difficulties. Then another one is mental retardation. What is mental retardation? This refers to significant some average of intelligence and deficits in adaptive behavior. So these are now the individuals who are really having a problem in their cognition, and really find it hard to remember, find it hard to speak what is in their minds. And if you are teaching them today, whatever you have taught them today will be forgotten tomorrow. And there are, of course, levels of mental retardation. We have the first one, the mild mental retardation. They have an average of intelligent quotients between 50 to 75%. But because it's a bit higher, so they can acquire academics up to 6th grade. No, they can go to school and understand up to 6th grade because they have an IQ of 50 to 75. Although it will be hard and difficult for the teacher to really train them as compared, of course, to normal students or pupils. Then we have the next, which is moderate. These are now those students and pupils who have mental retardation. Their IQ is, of course, has an average of 35 to 55%. They can carry out work and have self-care tasks, but they needs to be taught repeatedly of the simple self-care tasks such as wearing their shoes, lacing their shoes, or say for example keeping the waste, throwing them on the trash cans. Then we have also severe. Their IQ is between 20 to 40% in average. And these pupils who have mental retardation may master basic self-care skills and some communication skills, but you have to do it with patience. Okay, they can also tie their shoes. They can also bring their bags on its proper boxes, but they have to really do it as as the mentor or as the teacher is given careful attention to them, and they must be consistent in what they want to teach them, especially these simple self-care skills as well as in communication skills. You have to really take time to teach them the alphabet and its sounds, and it will be very good if you will be doing it in a law of exercise or law of repetitions. Then we have also the highest problem of mental retardation is called profound, in which these pupils or students have an IQ of lower than 25%. They will less be able to develop self-care and communication skills with appropriate training. So these pupils having a problem of mental retardation as well as autism really needs an expert, a master holder of a special education, so that they will be attended to properly. Next, we have emotional or conduct disorders. And these emotional or conduct disorders are aggressions over a considerable amount of time, meaning these are the students who could not control their emotions, who could have the longer display of negative behavior. Then under this, we have the following signs. One, there is the presence of emotional states like depression. And we have discussed about the three categories of exceptionality. We have the learning disability, and under learning disability, we have attention deficit hyperactivity disorder or ADHD. We have speech and communication disorders or SCD. And then the second one, we have the social, emotional, and behavioral difficulties. We have two also. We have autism, and of course, we have mental retardation under social, emotional, and behavioral difficulties. And we have the third one, which is called now the emotional or conduct disorders or the ECD. And these emotional or conduct disorders are really students who are not, who could not control their excess emotions and the displays of problem to avoid by other students and sometimes, of course, the teachers. And then we have also the following effects. If we have students who have physical disabilities and health impairments, the following are its effect. One, there will be limited energy and strength. So most of these students are not that well, are not that fit, so they have only limited energy and strength. So if you are handling students like them, there must have a lessened time of engagement as compared to normal pupils or normal students. There is a reduced mental alertness. So the attention span is really very short. If most of the individuals, especially those that are high school or college, have quality time span of 20 minutes in average, these students who have physical disabilities and health impairments, they have, of course, reduced mental alertness. It's good if they can focus for 10 minutes. And then, of course, they have limited muscle control, especially those that are having autism or mental retardation. They could not handle things such as glass or bowls that can be broken because they have limited muscle control. Now, in this discussion, we have also the so-called severe and multiple disabilities. When we speak about severe and multiple disabilities, these are the disabilities encountered or the students who have multiple disabilities or the pupils having them have two or more different types of disability. And we can also say that disability is under sensory impairment. And under this, we have two. We have the so-called visual impairments, and we have also the hearing impairments. So when we speak about visual impairment, there is, of course, a malfunction of the eyes for optic nerves. So they could not see well. They can be too much farsightedness or too much nearsightedness. And of course, we have hearing impairment, and this is about the malfunction of the ear or auditory nerve that hinder perception of sounds. These two impairments are really severe in multiple disabilities that must be taken care of by a doctor to look into what necessary help that can be given to them. And then under also this study, we have, of course, not only negative, but of course, giftedness. Under the giftedness, they have high level of cognitive development. So there are schools who are really catering to giftedness, because if they will not be catered properly, their gifts will be forgotten and it will not be enhanced. So having a star section is one intervention to cater to some giftedness, because these students or pupils have a high level of cognitive development. They have also unusual high ability or aptitude in one or more of the following. The first one, they have high IQ or intellectual ability, more than 100, I think. Then some have aptitude in academic subjects. There are some who are really very, very good and excellent in mathematics. They can solve complex problems, and some are very good in English, and some can write, some can compose, and some are very good in other academic subjects, and which they can memorize. We have seen baby children in the television who can recite different countries with their corresponding capitals. So or the flag, we can see that you just show them the flag and they will see what country is the owner of that flag. That is a bit of giftedness. Then we have also those students who are so creative, no, in drawing or in the making of arts. When you assign them to make a certain output, they will not do it as simple as like the students, but they will do it so creative, and not only artistic, but they can create a different painting or a different cutouts, if or a poster making is usually seen in the schools, and those, of course, students who are winning in poster making can be in this category. Then there are also those students who are gifted visually on performing arts, wherein they can act, they can express effectively the different emotions, and most of them can be seen in the glee clubs. They can be seen, of course, in the drama, theater, arts, something like that. And of course, there are also students and pupils who are gifted in leadership. And most of them, of course, win in the student councils, or when they will be good politicians in the future, but I hope that they will not be corrupt. Okay, so thank you for listening.
Share Jesus. Subscribe and share Paraclet TV. Go, go, go.